So now I'm going to look at some of the positions for pregnancy work on the floor. But even before we get onto the floor, it can be nice to be sat on the ball. We could use the sitting on the ball position as a position for the initial consultation. And we could actually, if we're going to do lymphatic work, already start doing a little bit of a lymphatic work, or getting the client to move her arms and stretch, all the different exercises on the ball. Then we can take the ball away, and the client now lying on the floor is basically the same as what we saw on the table, but of course with the floor we've got a lot more space, so we can use the same equipment. I won't today have all of the cushions because you've seen all of those, but it basically looks exactly the same as on the table. The difference here, if we did actually want to do a rolling to the side, we have got a bit more space. So if the client was comfortable rolling onto her back, and I'll show you how we can do this, but maybe you could roll her onto her back and then she can roll on to the other side. You see you've got plenty of space. But still, the option that I tend to prefer, if the client's comfortable, is going through all fours. So we could go through all fours like we did on the table. So we simply get the client to come on all fours and she can do all the movements that I showed on the table. Or on the floor, you could actually get the client halfway through the session. Maybe it's quite nice to do a little bit of the ball work. Sometimes I do ball work at the beginning of the session, sometimes I do it at the end, but you can do it in the middle. And so the client could be on the ball for a little part of the session, and then when the client's on the ball, I cover the ball. You could then move the ball out of the way, and then the client simply lies down on the other side. Same positioning ideas as we saw for the table. So that's to just give you a little bit of an idea of the main differences between working on the floor and working on the table. We have to make sure that there's sufficient enough padding so that the woman is comfortable, but otherwise most things are pretty much the same. Thank you.